Awesome. So, a couple minutes late, but hey, it's real early here in Texas. Uh, we're so happy to get the team together here as a preparation for our September course, Beyond Periortho Limits. Uh, Really fortunate to have our friends join us from Spain. We have Daniel here from Madrid. He's live in the planning center. And we've got both Guto and Octavio coming in from Brazil, diligently waiting to go do surgery themselves. So I really appreciate you guys coming on this morning. Good morning.
Good morning. Thank you.
Morning, Todd.
Morning, everyone. Nice
Yeah.
to be here.
Of course, my partner in crime, Dr. Romero, is here. And we're excited to get back to business at the Institute of Houston Dental Synergy. We've had a few courses, but this will be our next, extended course of a 2-day this September. And Giancarlo and I are really excited to bring this course back to Houston. Last year we had to do it via Zoom. And we're so excited to have people back in the classroom sharing that energy and camaraderie and really providing learning that we think can be a game changer when it comes to the digital workflow and just interdisciplinary care in general, working amongst the specialists with our restorative dentists to achieve the very best results possible for our patients. That's really what this is all about. So in preparation for the course last year, what we did is we did an online presentation where Danielle walked us through really what this concept is. We're not going to do that this year, but today I think Danielle will be able to give us that same kind of course overview that allows the viewer to understand why you'd take this course, who should come, and what kind of benefit it has to your practice and to your patients. So I'm going to share my screen really quick. Giancarlo, anything else to add about IHDS? In general, not specific to this course, but what we've got going on regarding other courses?
Well, IHDS, yes, definitely. We're trying to just bring a platform right here in the middle of the U.S. where multiple specialties can get together, and also different type of courses, not only from the dental standpoint, just from the marketing standpoint, from the digital design, from the lab design. So we're trying to, in a synergistic way, gather all specialties, all the disciplines of dentistry down here in the middle of the U.S. pretty much.
Yeah, and I think that the cool thing about our faculty that is in Houston is that it represents all the disciplines of dentistry. It provides a large faculty that can give a better ratio of teacher to student. And it's covering everything in dentistry from basic composites, the worn dentition, airway focused dentistry, implants, regeneration, perio-ortho, oral surgery. We have another course in September on zygomatics and pterygoids. It's not something that I do at all, but certainly it's the big buzz in the profession. So we're bringing in Danny Holtzclaw to do a program for us. So we're really listening to the students and saying, what do you want? What do you need? What do you really want to have? And we'll bring in a key opinion leader to lecture on it. And if that's successful, we'll bring them back the next year for a live course to do some hands-on or potentially live surgery. So we're super excited to be open again. And what better way to really kick it off in the fall of 2022 than this course that I know Danielle and myself and others have worked so hard to kind of create and have the support of DSD to work through some of these beta tests. For instance, the SFOT guide that we'll talk about. All these things are really exciting for us because they're new, they're innovative, and they're have the great potential to allow us to do things better. So with that, I'm going to share my screen. So as a way of further introduction, because not all of us are on this this presentation this morning, but Dr. Crocken, John Crocken is an orthodontist here in Houston, someone that really focuses on adult orthodontics. And we not only, do we treat kids with paddle expansion and other things. But most of our advanced surgical techniques with skeletal anchorage, SFOT, and orthognathics is in the adult patient. Dr. Romero, as I mentioned, is a maxillofacial prosthodontist, unique individual that not only is he an unbelievable dentist, but he's got a fully functional digital workflow laboratory that we have access to through IHDS to see how one functions and also to support our courses. Myself, I'm a periodontist from Houston, Texas, been in practice for 22 years and have a passion for digital dentistry and kind of all things perio. Danielle, our partner in crime from Brazil, Giancarlo and I met at the Well Clinic at DSC Residency 2, and automatically we had synergy for our quest to provide better, more efficient care using the digital workflow. And we were gifted to meet Gustavo there. He came and did the live course for us at the Residency 2, using the double crown lengthening guide, and he and his brother are inspirational. If you follow them on Instagram, they're amazing surgeons and great guys too. So we can't wait to have him involved this year. It's a pleasure to bring someone of his caliber into the IHGS teaching facility. Octavio too, we got to watch a presentation from him during Residency 2, which is unbelievable to see a orthognathic surgeon like this take it into the full digital workflow. So this team is awesome. I'm privileged to be a part of it, and I'll hand it back to Dr. Romero here. Let's see. Well, first, the course, September 24th and 25th is a 2-day course. Daniel will go over the curriculum here in just a moment, but we're bringing it all together. We'll have Octavio and Guto coming in via Zoom. Just because of the uncertainty with travel, we hope to have them live, and who knows, but it's looking right now like they'll have to join us via Zoom. We'll also have some special guests joining us via Zoom, and then Danielle, myself, John will be live in Houston, Texas at IHDS. I believe now the website is available to register for this course. If it's not, if it's only the webinar that was available, we'll have the registration for the course coming live here pretty soon. Giancarlo, any?
The website is open for registration already, Todd. And one of the things that I want to touch that you mentioned in the beginning of this conversation that we're having is I do believe this course is going to change your practice. I do believe that this is a course not only for specialists, okay? This is a course, I would say, more target to general dentists, because this is what happened is in all our education. I mean, all of us have been out of school for quite some time, and for sure we did not have this pleasure of having this information by the time that we were going through dental school. But the reality is, even the people that are going through dental school right now and the new dentists coming out, they're completely out of touch, or they're completely without this information, which is critical. It is critical because for me, this is the missing link that we were looking for back from years ago. We know that a lot of influence of good clinicians like Coyce and Spears, they touched on this many years ago, but now we have the realization of, with Christian Coachman, which brought all this to life, of how to plan a case. And me being a restorative dentist and a prosthodontist, it's just an apex of information that I can gather from my patients. And then not only I can communicate easier and just make an illustration of what needs to be done on this patient for my colleagues, for the periodontist, for the orthodontist, for the oral surgeon, but for the patient itself. So this is for me a course that is, I'm so glad, Todd, that you put all these together, because this is gonna be amazing to participate within this forum, okay? And Danielle, I'm gonna pass it to you.
Hello, everyone. Hello from Madrid here. I'm talking today directly from the planning center. And well, it was a long journey to get here. Not talking about from Brazil to planning center, but since I started as orthodontist, and I know it doesn't look like, but I am orthodontist for 20 years. So you're probably going to be surprised with that information. But during my journey, I tried every year or from time to time to implement something new to my patients, always looking for improving their experience. And everything changed the first time I got to Well Clinic in São Paulo during the first course that I saw Christian Coachman. So exactly like a young boy going for the first time to Disneyland, I was amazed with everything happening there. And from a moment, that moment on, everything changed. And I dedicated the last years to improve and to put in practice everything. And well, this is something that this kind of course I wish I had done in my first year as orthodontist. As Giancarlo mentioned, this course is not only for ortho, it's not only for perio, for surgeons or prosthodontics, it's for every general practitioner, every dentist who wish to provide a better care to the patients, right? Because it's all about interdisciplinary workflow. It's about interdisciplinary brainstorming. It's about understanding the ideal and doing everything that we have in our hands nowadays to achieve that ideal. Concerning about airway, as Todd mentioned, and they are going to go deep inside those concepts during the course, it's knowing that orthodontics has limits and we can have tools to surpass those limits. As you are going to see, they use of SFOT, of acceleration, of orthodontic surgery. Sometimes we cannot increase the size of teeth, so we can call Guto to do his magic with amazing crown lengthening guides, facially driven. It's a course that I believe it's going to change your practice. And for the comparing to the last year, we have a lot of things new taught, Giancarlo, Octavio, and Guto, a lot of new products, a lot of new protocols, and some of them we're going to bring for the first time during this course. As for example, I can only mention the name, the new DSD TAD guide, facially driven. It's amazing. We are testing, finishing, and it's going to be launched there. So this is what about this course. It's going for the ideal and don't accept less, because in the end, it's going to be the best for the patient, okay? Um, in my part, just to mention, I'm going to discuss how I started providing a better, faster, more predictable treatment with aligners, because in the beginning I was suspicious about what can be done with aligners. I came from old school orthodontics with braces, and then I entered in this world because DSD is completely linked, is digitally linked with Invisalign. And I started to get better outcomes, better results, more predictability when I included micro-osteoperforations, vibration, and the use of skeletal anchorage. So this is going to be my part during the course. And of course, I'm going to join Octavio to give some insights about ortho during his lecture about orthognathic cases. I know that Todd asked me to join, to share with you the program. Okay, probably we're going to have some changes and additions, some surprises until there, but just for you to take a look about what's going to happen in September. Okay, so we divided in 2 days because we understood that one day we couldn't go deep enough in those topics. So we're going to have a morning to discuss. I try to move from the simple to the complex cases, right? So the simple cases where we need to increase predictability, I understand that the use and understanding about bone biology and bone remodeling and the use of micro perforations and high frequency vibration, it's a huge add. So after the introduction of the course, we're going to dedicate some times to see that. Later, I invited my good friend and the education coordination here at the DSD, Lucan de Arbeloa, to talk about the new DSD hands-on app, which is a free app that can be used to do 2D designs and to help the planning in the first stages. I'm going to present a new DSD TED guide, the full workflow with a case done by Jesus Crea, okay, this doctor from Spain. And the demonstration. Later, Guto, can I call you Guto, right, Guto? Because I always call you Guto, so Gustavo, I think, is too formal.
Of course, my friend.
And Guto is going to come to present his cases and his technique, amazing technique. I really
do you mind if, just because of Guto's timeline, do you mind if we allow Guto to expand on that now? That way, if he has to run to his patient, he'll be...
Yes. Do you want to share the presentation screen for him, or can I leave here?
I think leave this on, it'd be great. And then we'll just pin him.
So since I already introduced my friend Guto, please, Guto, tell a little bit more about what's coming for September. What can I expect?
I'm super, super happy to join this team and to have the opportunity to discuss a little bit about Perio in this amazing program, because I think this is really important for students and for the clinicians, because actually I'm just a little bit jealous about the Houston welcome party, drinks and Texas barbecue. Actually, I will be like super sad at the day, but it's okay. But I think it's amazing, because I think we live in a world, in an analog world, and we had a lot of reactive treatments. As I remember when I graduated, I remember when we started to do perio surgery, I remember that all the patients was referred to me to, hey, Gustavo, the teeth are a little bit short. Can you just crown lengthen the case? Yes, of course, but base it on what? What is the result of the treatment? Do you have face pictures? Nothing of that was discussed, and we had a lot of reactive treatments. You do the surgery, then you wait the result, and then maybe with ceramics or maybe with different surgeries, you can maybe correct the problem. Or maybe let's go for more complex cases. You take a patient, a very complex patient, and then you do orthognathic surgery, you fix the problem with the bone, and then okay, let's now look at the smile. And then you start to cut the soft tissue, and okay, maybe it's nice if you go for the restoration. Always a reactive treatment. And then if you have a very good team and lucky, you finish with a very nice result. So today we look completely different to that. And this course will summarize this thing, because when you take a patient, let's take a simple case or a very complex case, we always try to look at the patient first and design first, and then go to a non-reactive treatment. Okay, you first design, and then based on this design, you are going to create a treatment plan. And then all the specialties just go ready for the design, Now, going for perioplastic surgery, as I'm going to explain with the guides, with the virtual plane, it's everything based on the first design. Everything based on what we are going to achieve with this patient in the final result. Not only, okay, patient has short teeth, let's crown it. No, of course not, because we have completely different diagnosis. I can change the lid position, we can change the bone position with Otavio, I can change the soft tissue position, the tooth proportion, everything can change. And if you don't look to the teeth, and if you don't design the patient first, you are going to react all the time and try to fix problems. And this is not the goal for us. First, we design, then we understand with the patient the final result. And after that, you are starting to create guides. You start to use technology, combining with the biological concepts to achieve nice result that you already designed. Everything is more predictable now. I think predictability is a very cliche word, but this is the world. It's predictability. When you design and then you go ahead following the design, it's really the key for the success in complex cases. And I'm going to show a lot about how can you just try to design the guides, how can you use technology to go for your surgery with a lot of predictability, understanding if you need to cut soft tissue, how much do you need to cut soft tissue, understanding if you need to cut bone, if you need to open flap, if you need to go for osteotomy or osteoplastic surgery, how can you go with this simple procedure, but very important procedure at the end of the result? But we are not going to look at the patient just in the end of the treatment to do this. We are going to understand this in the beginning of the treatment, and it's going to go very smooth and very nice in the workflow. Let's understand the tools, let's understand how to use it, and let's understand when you go for more complex case, how can we change from a complex case to a simple case? Because imagine when you take a patient in your office, like a very complex case, and then you look and say, well, when or where should I start? We always take this patient and try to change everything according with the final design. Let's change this place, a complex case, for a simple case. And then when we change this patient using skeletal anchorage, let's discuss a little bit about mini plates. Let's discuss a little bit about mini screws, the difference between both, the technique, how can we place it? How can you minimize the trauma in this kind of patient? When you change, like doing orthognathic surgery, ortho with skeletal anchorage, and you have now a simple case, not anymore a complex case, and then you just finish very well with the crown lengthening guides and a very simple procedure. I think it's going to be super nice. I see my time here. I'm going to be super fast because I really want to show a lot of nice things and new things. And I'll be super happy to join. I think it's going to be super amazing.
Awesome. Thank you so much. And Daniel, I'll hand it back to you.
That's amazing, Guto. I still didn't accept the fact that probably you are not going to the barbecue party and everything else. I didn't give up of that, okay? And since you have a lot of...
If I go, we are going to change from night a little bit in the morning. It's not good night and...
Okay, this can be done for sure. And you brought some interesting points that maybe I moved too fast with my speech. The concept of always starting by the end, right? And understanding where is the end, and later with the team effort, interdisciplinary discussion using planning center or with the team, doing this reverse engineering process to understand which specialties they are going to participate in the treatment, and the effort for every specialty to give the insight and how he can contribute to achieve that goal. And of course, always trying to make the complex more simple, okay? And in this direction, of course, to make the complex more simple, nothing better than finishing the first day with a welcome drink parties that the guys in IHDS, they are really experts doing it. So this is a good moment for us to keep talking, know each other. And this is how I met Todd and Giancarlo. The idea and the brainstorming about this course started at the barbecue party at the WOW Clinic. So I believe a lot of good things come from these moments. So, and the second day, a very important topic. And I can say that because now at the planning center, discussing a lot of cases, I can see how important this concept of SFOT is if we really want to achieve the ideal result, if we really want to make an improvement of the airway and create a better condition for us to finish the case with the ideal aesthetics and function, which is the surgical facilitated orthodontic treatment. And we are going to be very happy to have Todd presenting his experience, Todd. And so if you can please anticipate to us a little bit of what we can expect for your lecture in the second day of the course.
Yeah, so I mean, this is something that I've I've worked on for close to 20 years. I first went and after residency went and spent time with the Wilco brothers. That kind of started that whole concept of using the wrap effect to facilitate tooth movement. What they provided to the dental profession is quite amazing. They get criticized quite a bit by some of their methods and outcomes, but quite honestly, we should be thanking them for bringing this to the profession. And then all the others that have contributed along the way, Rick Robley, George Mandelaris, big proponent of this and kind of my compadre when it comes to SFOT. We're working on a textbook chapter right now with the team on this call for SFOT. It's a powerful tool. Now, it is a tool. It doesn't replace orthognathic surgery. When the movements are too great, we need our oral maxillofacial surgeons to assist us, but it is indeed a powerful tool. And I'd say the beauty of this course is not only are you going to learn the foundation of SFOT, but you're going to learn about the innovations of SFOT. Right now, using coracotomies with TAD-based palatal expansion is an absolute game changer for kids and adults. 2 weeks ago, I opened the palate on a 64-year-old female, right? An airway patient that hasn't been able to sleep in years. She's at her wit's end, and we were able to separate her palate without a surgical assist. Didn't have to go to the operating room for a dome technique or a SARPI. We did it with MSE. And then in her mandible, we're doing SFOT to try to gain some expansion in the mandible. So it's a tool that opens my eyes sometimes to things we thought we could never do. And there's innovative things that we're going to be bringing to this course in September that I think will absolutely blow your mind when you see these clinical cases. And John's not with us this morning, but we couldn't do it without the orthodontist and the restorative dentist and the planning that we do for these cases is quite amazing. Now, I will tell you that most of our palatal expansion cases, we do it before we institute the full DSD. So we get the palate expanded first, and then we re-record them. But we still start prior to palatal expansion with the DSD plan so the patient can see where we're headed and why we're doing all these things. I think, Guto and Danielle alluded to this, but the power of the digital workflow is to help patients understand why they need this or that or the other. That's the key, is to really have this ultimate informed consent so that they understand why they're doing this and can ask questions and be prepared to why they're going through these extra procedures, extra cost, extra time, is to achieve the optimal result that's based on foundational of health and wellness, not just aesthetics. I'll also mention what Daniel left out is that during lunchtime, we'll have some hands-on with TAD placement and maybe some MOPS, microosseous perforations on the first day. And on the second day, we're going to try to expose you to the SFOT guide, something that I've been working with the Planning Center and Francis Coachman on creating these beta guides. I know Rick Robley is doing the same to create an SFOT guide that allows the unexperienced clinician to have some guidance on these coracotomies / osteotomies. I would say that for someone that's been doing this a long time, it may be more cumbersome than it's worth. But for the residents out there or people that haven't done SFOT, it's an unbelievable adjunct to your therapy to help you feel like you're doing accurate and safe treatment around the roots of teeth or sinuses or nerves. Guidance is always helpful, but you have to understand the limitations of the guide. You have to understand the fit of guides, when to recognize when they don't fit, unless the guide is no good to you. So we'll talk a lot about that on the second day. And then we'll lead back into what really the DSD concept is as far as the DSD clinic, and who better to talk about that than Giancarlo, who is a DSD clinic, and hopefully have some special guests to talk about that as well. Danielle, anything else you want to mention, or Giancarlo, about the DSD Planning Center or specific to DSD? Because I think I'll say this one thing: this is not a DSD course. This is our course. We are very fortunate to have DSD involved with it, and we hope that maybe we can collaborate with them even more next year. But we want to prove to our attendees and to the DSD team that this course can survive on its own because we're utilizing concepts, not just commercial support for this course. So Danielle, anything you want to add to that?
One thing that I forgot to mention, Todd, is this course is also more for your team members within your practice, because we as clinicians, we're seeing patients, we're busy all the time, and the gather of information to get ready to send to the planning center, it goes on the shoulder of the team of your practice. So it is crucial that when you embark into digital dentistry, digital planning, that you have a great team. So this course will encompass all how to implement this on your practice.
Great, awesome. Danielle?
Yeah, well, the DSD clinic concept, it's pretty much a way that DSD found to guide new clinics in this process. It's not easy, right, Giancarlo? Sometimes takes a lot of time, and the team needs to be fully involved. And this is how can we help on this process, because it's a full-time support, and we can discuss the cases, and we can train the staff, and this is an amazing opportunity, right? And a lot of people, they don't understand exactly what is to be a DSD clinic. So I hope this day we can have JJ Gomez, who is the coordinator of this project, and Francis here from Francis Coachman from the Planning Center, with Giancarlo, to explain a little bit more about about this concept, right?
We don't want to get into that too much today, but I think the viewers on here, everybody's asking the questions. There's been some changes with the DSD education and access to the planning center. If you need that information, you get a hold of one of us. Christian did a great webinar for us a few weeks ago explaining all that, and we can get you access to understand that. We just don't have time to really dive into it this morning.
Perfect. Following this topic, after Giancarlo, I'm going to bring back Todd again, and with John to discuss a little bit more. I know it's kind of linked with the topic from the morning, right, Todd? But
yes.
In this moment, they are going to go deeper about airway and the use of MARPI to achieve better expansions and better results, and how important this is for the quality of life of patients, right, Todd?
Yeah, absolutely. I think that in our practice now, with amongst our team, we're focusing on global diagnosis and treatment planning, a la Bill Robbins and Jeff Rouse, and that must include the airway. So we're even before facially generated treatment planning, we're having that airway discussion. And it's amazing when you start looking for it, how many of our patients, not really ill patients, but just bruxers, people that are bruxing significantly, and bruxing is seen as a secondary factor in their gingival recession or occlusal wear or whatever. We have to have that discussion first with them to enlighten them on the power of bruxism and the deleterious effects it has upon oral health. And when you have that discussion about the implications of airway-induced bruxism on the mouth, then you automatically go towards overall systemic health and wellness. So I think as dentists today, we have an unbelievable opportunity and responsibility to have this airway discussion. So we would be remiss if we didn't include this in this course.
Yes, and by the last but not less important, right, Octavio? This topic that I am completely in love with it, because Octavio actually make me feel this way with his technique and the way we can now plan the cases, and the way that we can now have so much predictability. This word you are going to listen a lot, although it's old-fashioned, right, Guto? But it is actually something that we look for. And starting orthognathic case by the end, it's something that no one in the world, I believe, knows more than Octavio Sintra. So what can we expect for this amazing lecture to finish before the Texan barbecue? This is something that I put there. I hope to have it, right? I really want to have this barbecue.
For you, Danielle, of course.
Okay. So thank you so much. I didn't give up also about the barbecue. You guys know that I have a special feeling about Texas, because in 2001, I did my fellowship in Dallas, in Parkland Memorial Hospital. And so I have a special feeling about this place, and I would love to come. Before I start saying something, I would like to say that is a privilege. It's a huge honor for me with you guys here again. This is amazing. You are an amazing group. I'm very happy to have very good professionals from Brazil with me, two amazing professionals as Daniel and Guto. We just lost Daniel to Spain, but it's how life is. And the other one is the most handsome dentist in Brazil. And it's a privilege to be with this guy also. And, you know, guys, I'm a surgeon. And then during the program, when you are doing your training program as a surgeon, you have to focus in the technique. You have to understand how to cut, how to put sutures, how to screw, how to cut in the right way, how to avoid damage, how to be somehow minimally invasive to the patient body. And so this is technique. So this is how I learned. I've been learning surgery for more than 20 years. And then this course is not about surgery. This course is not about technique. This course is much more comprehensively. It's how to see your patient comprehensively, how to put all the different islands, different specialties together. Because me as a surgeon, I don't practice any other specialty. I don't do restorative, I don't do perio or ortho, whatever. But I would say that 100% of my patients, they need other specialties. They are not only surgery patients. So somehow this course is how to incorporate this way of watching the patient comprehensively and how to understand that you have one line of the planning, one direction of the planning, and it's completely the opposite line, the opposite direction of the treatment. So you have to plan from the end to the beginning, and then you're going to start doing your treatment from the beginning to the end. So somehow have how to understand now in the digital world, because I was born in the analogic world, and now I'm working in the digital world. With the digital world, it's very possible to understand everything, to see and to visualize your patient in the end of the line, and is a very, very powerful, is the most powerful tool to communicate with your patient what he needs, as Todd just said. Because patients, they need to see what's going to happen, to incorporate in their minds why they need other specialties, why they need other treatments, why they need more costs. And then when they understand that there is very possible to achieve the ideal, they go for it. It's amazing because they want it. So with this kind of feeling, I feel very, very pleasant and honored to be with you guys here again. And I hope I can come also, but if it's not possible, for sure I'll be online, and it'll be a pleasure to share more knowledge and to understand and to learn from you, because for me it's a learning curve to be with you.
Thank you so much. And we're going to get back to full screen here. Oh, there we go. Awesome. And I think that, you know, that sums it up really awesome, is that to end with what we'd all consider the most involved part of facially generated treatment planning or treatment, and that is when we must depend upon the orthognathic surgeon to change the skeleton. We all, I think all of us, even Octavio, want to figure out a way to be less invasive for our patients. So if we could accomplish something with an outstanding result and avoid orthognathic surgery, that's a bonus for the patient. If we could achieve an unbelievable result without SFOT, that's a bonus to the patient. If we could achieve an outstanding result without preparing teeth, then Giancarlo would agree that that's the best for the patient. This is our philosophy. We want to do as little to the patient as possible, but have an outcome with excellent results that has a foundation of oral health and function, and aesthetics will come along for the ride. We aren't talking about veneers and aesthetics. That comes along with this discussion, but our primary goal is a foundation of health and function, in being as minimally invasive as we can for our patients. So that's what we're going to try to bring to you in September. I'll tell you that this webinar is recorded and will be shared with those that register on our website. So if you have people on your team, your orthodontist, periodontist, oral surgeon, lab tech, team members, if they want to view this, all they need to do is go onto our website and register for free, and they'll get a link to watch this recording later. You that took the time to join us this morning, thank you so much. I know some of you on here are airway focused dentists, and this is kind of, I think, the next step in the airway journey is understanding interdisciplinary care between the specialist, including the laboratory and all the restorative dentists, to work as a team to accomplish things that we couldn't accomplish before. And that's a powerful thing for us today in dentistry. And I think what keeps this team all passionate and moving towards the future is we've got some amazing tools that we have access to, amazing collaborations all over the world to be able to offer our patients something great. So in closing, if I could get each of you, starting with Guto, because I know Guto has a surgery waiting, just anything to finish off and make sure people get signed up for this course.
Thank you so much. Thank you so much, Todd. Guys, just sign for this course. It's going to be super amazing. A lot of interactive information. It's going to be good for your clinic and your patient and the way that you think. So I'm really looking forward for this course. I'm going to learn a lot, and it's going to be amazing to share just a little bit about this whole complex case, which is the human being and the patient. So just join us. It's going to be super amazing. I will prepare a very, very nice material for you guys.
Thanks, buddy. And big hugs, man. We hope Octavio and you can be in Houston.
Thank you so much, guys.
Octavio, anything
Yes.
in closing?
Oh man, yes. As I said, it's a privilege for being here again, and then join us, because this course is not only about techniques, about a philosophy of work. So it's how to work properly, how to plan everything together, and how it's possible to get very complex cases and transform those patients in a very straightforward treatment plan, and how to make them predictable with amazing results. So it's not possible to understand and to see patients anymore as just one specialty working. You have to work together and have to organize specialties. So I work as a surgeon, Daniel, we're gonna work as an orthodontist, Gustavo gonna work as a periodontist. So everyone, we're gonna do the best of yourself, but everyone together in the same treatment plan, organized with a digital flow, very straightforward and very predictable in the end. So I'm gonna learn a lot again, as I always do. So join us, and then you're gonna see there. See you in September.
Awesome. Thanks, Octavio. And Danielle, I'll let you come next and have Giancarlo close us down. Danielle, kind of, I consider you the course director, course co-director here. So, thank you so much for helping me put this together, and I'm so excited to do this again with you. So thanks for this morning. Thanks for everything. And we'll look forward to a lot of action over the next couple of months in preparation for this outstanding course.
For sure. I am thrilled to participate in this course. I really like your quote, Todd, about that we are always looking for ways to make it simple to the patient, making less invasive, but we need to be prepared and to know how to provide the ideal treatment, and if orthognathic surgery is needed, how to do it in a very predictable way, reducing the risks. If we need to do SFLT, how to simplify using guides and to plan according by the design, the ideal design. So those concepts we will review, and of course we always learn from each other, and we are always bringing new cases and new techniques and new guides, and this is something that for sure that is going to be with us there. We are going to learn together, and we're going to brainstorm together. It's going to be amazing opportunity to have some answers and to bring some doubts. So come with us. At least in the end, we're going to get a cold beer and a good Texan barbecue to celebrate this moment.
All right, nice. Giancarlo.
Well, I can close that. this is a game changer for your practice, for your philosophy. I don't know. I don't care how many years you've been practicing that you feel in your comfort zone, that you thought that you were delivering the best result to your patients. I was there. I've been practicing for, I graduated probably 30 years ago. I've been practicing for about 25 years since my residency. And I thought I knew it all until I got down with the DSD team, until I got down to Brazil, until I got down to see how truly interdisciplinary approach should be worked. So it changed my practice. Now I come happier to my practice because I know most of the results that I'm going to give to my patients are very predictable. You take away, you take out of the equation the doubts of the patient. So when you take that away from the patient, the communication is just a two-way communication, very easy to communicate with the patient, no excuses whatsoever, and you hold the patient accountable most of the time because it's a check process of what you're going to do. So it is a must to come to this course.
Awesome, guys. Well, I appreciate this morning. For those of you viewing, again, please feel free to enter any questions in the chat box. I'm going to stay on here for another 5 minutes just to make sure I don't need to field any questions. But the bottom line is the course is coming back to Houston September 24th and 25th. And it's a course designed for the interdisciplinary team. If you can come with a team of perio, ortho, oral surgery, and restorative, that's an incredible opportunity. And then we're going to keep you informed over the summer months here with repeat broadcast of this and other things that are going to be going on this fall, including our second implant fellowship of the year. That's a great opportunity for restorative dentists that want to bring implant placement into their practice. And then we've got other great courses coming, some having to cancel because of COVID still, which is unfortunate. We're losing a couple tremendous courses that we hope to bring to Houston, but we'll have to wait till 2022. So check out our website. It's got all the courses on there for the rest of the year. Some, however, may be canceled. So bear with us. Unfortunately, we're having to still struggle with travel restrictions to the United States. So we're going to miss out on some people coming. With that said, good morning, everybody. Good evening to you, Danielle. Great to see your face, Octavio, Danielle, Guto, everybody.
Thank you.
Thanks so much, and we'll look forward to September.
Thank you all. Thank you for being here so early. For those who are waking up in Texas, and Octavio also is in the morning. For me, I need to have lunch now. Yes. So nice seeing you guys. See you soon.
Good to see you. No questions.
Thanks, guys.
Have a great day.
Guys, have a great day. Bye-bye. All right, so I'm the lone standing here. Feel free to email us any questions that come up at HDS. Simply you can find our contact info on the website, www.ihds-ce.com. So thanks so much, everybody. We will see you soon.